A warm welcome, everyone. I am Dr. Sheiladevi, and I'm very excited to talk to you today about the technology that's rapidly changing the landscape of medical imaging, extended reality, or what we call XR. All right. So we explore how XR, which encompass VR, which is virtual reality, and also augmented reality (AR), is being used in both clinical setting and also medical education. All right. This is particularly relevant for us. Okay, for us and for you as a future medical professional or whatever field you are in. Okay, besides medicine. It can be biomedical engineering, radiographic, or health technology because XR will become an integral part of your professional um, future. Okay, your professional career. All right. Okay, by the end of this presentation, you'll be able to describe AR, VR in the context of medical imaging. All right, and also you are able to identify the current clinical application of XR, right? To understand what is XR role, okay, in enhancing the medical education and to evaluate the benefits and limitations of XR in the healthcare. Right. So traditionally, medical imaging has actually relied basically on 2D presentation. Okay. Of course, we have reconstruct some 3D structures. Okay. For example, think of CT scan. Okay. MRI images and also X-ray. Doctors and students had mentally reconstruct of 3D structures. But this structure basically is more towards a flat structure. Okay, so this process has limitation. Okay, it requires extensive training, strong reasoning skills, and also this can lead to errors, especially in the complex cases. So it's very hard for the patient to visualize and to understand their own condition. All right, but XR is actually changing this by following us to the visual 3D anatomical structure in a more visualized way, okay, with interactive part of it. Okay, this is the best part. It has an interactive part, all right, interactive way when you are analyzing those features. Okay, so XR introduce new dimensions to diagnose imaging. Okay, so as future healthcare professionals, we will be like front line of the digital transformation. Okay, and understand what is XR crucially. Okay, so the definition of what is XR or VR or AR. Okay, let us see what is the definition. All right. So first of all, um, while we are talking about the model, okay, of medical imaging, the importance, all right, we also need to see the definition part. Extended reality is XR. It is like umbrella term, okay. Virtual reality is VR that immerse our complete, okay, immerse part of it, okay, towards a complete digital world. Okay, so like we wear a headset and you are transported to the stimulated environment. All right. AG, augmented reality, is like overlaying of a digital information onto a real world. Thinking of using some smartphone or like headset, special headset to see the virtual object, okay, like superimposed to the actual surroundings. All right, so this is quite important. This is quite important because we related to the transforming of 2D scan into the immersive and how do we manipulate the 3D model and to understand the complex anatomy structure, okay, of course, to reduce error for the clinical decision, okay, and to provide dynamic tool for the training medical student and also for the professionals. All right, so the traditional versus XR enhancing imaging. Okay, it shows visual explanation and someone using VR headset to view a 3D anatomical setting with someone using AR to see medical data overlaid on a patient is pretty much different from a 2D slide of anatomical view. All right, so the role of XR in healthcare plays very important role, basically on the finding of application across a various medical field. First, to enable the interactive 3D visualized in patient anatomy. Okay. Second is to support precious diagnostic, okay, diagnostic of a image guided intervention. Okay, then you can also have enhanced pre-surgical planning, okay, by looking at the AR and the XR. Okay, and it is also used to rehabilitate pain management and even the mental health therapy. Okay, so the traditional versus XR enhanced imaging, okay, it is like showing side by side comparison. Okay, so on one side, it shows a stack of 2D CT scan images. Okay, on the other side is showing 3D model of the same anatomy in a VR and AR environment. So you can imagine both are different. Okay, as mentioned, the traditional images will give a 2D slice, and also the clinician must mentally build the 3D picture. But it might have some limitation, okay, in the depth of perception, and it can increase the risk of error. Okay, while the XR enhanced image can convert this 2D data into the interactive 3D hologram. So you can manipulate them and rotate them and magnify them in a real time. Okay, this lead to better understanding, more accurate diagnosis, and also to improve the collaboration. All right. So, what are the challenges? Okay, XR in radiology, for example. Okay, XR in radiology. Okay, XR is like very much, pretty much revolutionized in the radiological part of it. It transformed the CT, MRI data into the 3D visualized, and also radiologists can view in VR and AR. This is a greatly enhanced the interpretation of complex structure like tumor, fracture, vestibular system. Okay, it allows to be more accurate to localize where is the problem. Okay, localize of the problem that happens through the imaging and also the video. Okay, it shows a radiologist using AR can be interfaced to view the 3D tumor within the patient body. This is one example. Okay, for example, like radiologists can virtually walk through, okay, organ that making it easier to spot the abnormalities. AR overlaying can fuse imaging data directly onto the patient during the procedures that guiding the bio, uh, especially, okay, for the radiotherapy, okay, biopsy, or the radiotherapy to make it in a greater precise. All right, that is radiological part. All right, and what about surgical part? Okay, for surgical part, it is very much powerful. Okay, it is very much powerful. You can, before that, in the radiological part, you can see the image. Okay, for the surgical part, okay, for the surgical part, is pretty much powerful. Okay, where the XR is also a powerful tool for the surgical planning. Okay, so the image like a surgeon using a VR headset to plan a complex surgery. Okay, rotating and to examine a 3D model of a patient anatomy. So before surgery, surgeon can actually use VR or AR to visualize the patient specific anatomy in detail, how they plan their approach, okay, and even stimulate the entire procedure. This is to allow a better preparation to reduce the surprise, okay, during the operation and ultimately to improve the patient outcomes. Okay, XR models help surgeons to determine the best um, incision point, okay, anticipate the challenges and also to precisely locate the critical structures. All right, so this is surgical stimulation and planning. Okay, entirely the surgical procedure will be there. Okay, using a real-time patient imaging data and also to optimize, okay, the point, right? Okay, this is looking at the image. Okay, is a you can see that XR is not changing the clinical practice. Okay, it is also not transforming the medical education. Instead, it is relying solely on the textbook. Okay, 2D diagram. Students can use VR to walk through it, anatomical model, to dissect the virtual body, okay, and to experience the realistic stimulation of my medical procedure. AR can also overlay the CT scan, MRI data onto a physical model and even the real patient, providing a dynamic and interactive learning experience. This has hands-on immersive approach that can specifically depend, okay, understanding and bridging the gap between the theory and practice. Even though the benefit and the limitation is there, you have seen many benefits of XR, okay, but there are also important to acknowledge some limitation. Benefit can be included as what I told you just now: improve accuracy, okay, enhance visualization, better training, increase patient engagement. Limitation can be the cost, of course. Cost of equipment is quite high. Okay, the learning curve for using new technology and also the need for standardizing protocols in data security. Okay, so in detail, there is pro, there is cons. Okay, so in conclusion, so XR is poised to reshape the medical imaging. That's for sure, right? And it enhances the accuracy and interactive and understanding for diagnosis, treatment, and education. It empowers the students, radiologists, and also surgeon, leading a more personalized and patient-centered healthcare. So as XR continuously evolve and integrate with other technologies like AI, its impact will really grow up. Okay, the future of the medical imaging is always immersive. Right, so there are some hardwares. Okay, example of hardwares. Okay, we call it as Oculus. Okay, AR device will be like HoloLens that I told you just now. Magic Leap, this is also part of AR device. Okay, then there are some softwares application. Of course, when you talk about AR, okay, um, you you need to have the hardware, you need to have the software. Okay, the software will be the application part specifically used in medical imaging like visible body, okay, OSA VR, all these are examples. Yeah? But whatever it is, we have to also consider ethical consideration. Data privacy is important. Patient consent is important. Okay, how are we responsible towards using XR technology is pretty much important. Okay, because in the future, okay, this XR may continue to integrate more and more with AI. Okay, telehealth is there, personalized medication is there. Okay, so now it is a time for the student, for the educators, for the clinician to embrace the XR technology that has been there, right? To reshape the medical imaging and also to bridging the gap between the technology and clinical practice to enhance the accuracy, interactive, and understanding in both diagnosis and education. All this will empower the next generation. Okay, XR can actually transform the students' learning. Okay, radiologist diagnose and the surgeon operation that will create personalized patient-centered healthcare solution. All right, so this is for today. Okay, thank you very much.